Hi, my name is Stephanie Lyle, and today I'll be performing oxygen administration. To do that, I have a nasal cannula, I also have my non-rebreather, and I do have some 2x2s to demonstrate how I would protect the patient's skin. So first things first is I will enter the patient room, perform hand hygiene with hand sanitizer. I'm going to verify the patient name and date of birth while introducing myself. Hi, my name is Stephanie. I'll be your nurse today. Can you please tell me your name and date of birth? Perfect. Thank you so much, Mr. Lyle. I have verified that information on his wristband. Next, I'll explain the procedure to the patient. All right, Mr. Lyle, it looks like the physician would like to prescribe some oxygen therapy for you. Looks like we're just not getting enough oxygen on our own, so we're going to supplement that. He has ordered 3 liters per minute via nasal cannula. Does that sound okay? Perfect. Thank you so much for your consent. So next I will get the nasal cannula ready. Open it up. I've opened this already because I've practiced a couple of times. So first thing I'll do is get this plugged into the flow meter, and then I would turn it up to 3 liters. And then I'll go ahead and place the nasal cannula on the patient. All right, Mr. Lyle, here comes that nasal cannula we talked about. It's just gonna go right on the inside of your nose and right over your ears. Perfect. All right, and then I'll make sure that the nasal cannula is not too tight, but not too loose. Looks like it's placed all right here. All right, Mr. Lyle, how does that feel? Does it feel too tight anywhere? Is it pulling anywhere, like on your ears? No, it seems to be okay? Perfect. So now that I've placed the nasal cannula on him, we want to perform skin checks at least every 2 hours on him. I do have some 2x2s in case I come in and he's got skin breakdown either behind the ears or maybe on the cheeks here. We can go ahead and place them wherever he needs a little more comfort so that the tubing doesn't cause any injury. Okay, Mr. Lyle, how do you feel? You feel okay still? Perfect. So I'm going to give you the call light. If you need anything, please let me know. Just press this button and I'll come right in. Otherwise, I'm going to step out of the room and document the procedure. Okay? Do you need anything before I leave? No? Perfect. So I'll go ahead and perform hand hygiene one more time, and I will exit the patient room and close the door or pull the curtain to provide him some privacy. I will document the procedure of placing the patient on 3 liters via nasal cannula. Okay, and then say the next thing is that maybe the doctor will give me new orders for 10 liters per minute via a non-rebreather. So after getting that order, I will enter the patient room again, perform hand hygiene, hand sanitizer, and then I'll explain to the patient what we're going to do. Okay, Mr. Lyle, the doctor, it looks like we're not getting quite enough oxygen, so the provider would like to bump up the oxygen to 10 liters per minute. And we're going to change out from the nasal cannula to a non-rebreather. It's a mask that sits over your nose and your mouth so that you can get more oxygen. Does that sound okay? Perfect. So for the non-rebreather, I'll take it out of the package. It should be closed, but I've opened it because I've practiced. So for the non-rebreather, 10 liters per minute, we're going to make sure that we're using a humidifier just because of the high flow of oxygen. It can dry out the nasal passage or even the mouth and the lips, and we just want to do our best to protect the skin and the patient's airway. So I would make sure that the humidifier was plugged in. I would disconnect the nasal cannula and I would plug in my non-rebreather mask and I would increase the oxygen to 10 liters per minute. Next, I will remove the nasal cannula. Okay, Mr. Lyle will take this off. And we'll go ahead and dispose of this in the trash bin, the trash receptacle. And then we'll go ahead and get this over him. So this is the bag if we want to inflate it. I inflate it when I'm at work in the ER by just covering the hole here and inflating this so that there's oxygen flow in there already. And then we'll just go ahead and bring this over his nose and mouth, making sure that the straps are not twisted up and that it's sitting okay here over his nose and mouth. With the mask, we definitely want to make sure we're looking at the skin integrity, specifically over the nose, because we've now pinched down this metal part to create a full mask so that the oxygen doesn't escape through, the little holes. It's just form fitted so that the oxygen that he needs goes into his nose and mouth. But because of the metal piece, patients tend to get skin breakdown here, redness, bruising. So we can provide those 2x2s, perhaps under the nose, to provide a little more comfort, or even behind the ears, like we talked about earlier. Let's place this under the ear, like this, or even on the cheek if we needed to. So, okay, Mr. Lyle, now that you've gotten this increase in oxygen, are you feeling okay? Perfect. Again, I'll leave the call light here for you if you need anything. If you start to get uncomfortable or you need anything, please press the call light and then I'll come in and we'll see what we can do for you. But for now, I'm going to step out of the room and I'm going to document the procedure. Is that okay? Do you need anything before I leave? No? Perfect. So I'll use hand sanitizer one more time, perform hand hygiene before I leave the patient room. Close the door, pull the curtain behind me again to give him some privacy. And I would document that we discontinued the nasal cannula and have now changed him over to the non-rebreather at 10 liters per minute, and that patient was comfortable when I left the room. At the end of therapy, oops, there we go, whoopsie daisy. But at the end of therapy, I would come back in the patient room, hand sanitizer one more time, that hand hygiene, and I would come in and say, hi, Mr. Lyle. Looks like we're okay. We can go ahead and discontinue the oxygen therapy that the provider prescribed. So to do that, we're going to go ahead and take this off of your here, but let me get some of these pieces here. And while I'm doing that, I'm also checking for skin breakdown on other places, like his right side of the face here, or anywhere else, maybe under the chin. And I would turn off the oxygen, and then I would dispose of this in the proper receptacle. And then, yeah, so I've already checked his skin. He looks okay. Everything looks intact still. I will give him his call light one more time. Ask, do you need anything else before I leave and go document this? No? Perfect. Thank you so much for everything today, Mr. Lyle. You did great. I would perform hand hygiene one more time as I exited the room, and I would close the door or pull the curtain. And then I would go and document that the patient tolerated the oxygen therapy well, and that he was resting comfortably in his room, or whatever he was doing, if he was sitting in a chair or something. But yeah, I think that's it. Thank you so much. Have a good day.